Good afternoon, dear participants. Hello, welcome everybody. How are you doing? Fine? Good lunch? Ready to go? Okay, very good. So, welcome to this interactive framework session on mental health promotion through physical activity and sport. We hear a lot about mental health nowadays, and including in the sports area. But what we want to highlight in today's session is that mental health is not only about fixing what's broken, it's also about building resilience, connection, and joy through movement. So, in the next 75 minutes, approximately, we will reveal together how physical activity becomes a powerful catalyst to thrive in communities, transforming lives one step at a time, one game and one moment at a time together. We're going to journey from evidence to action, so not only staying with theory, we're going to hear global voices who've scaled mental health performance from grassroots initiatives to international impact, and it's going to be full of inspiration, full of practical insights, and full of experiential learning as well. Does that sound like a good program to you? Great. So, I want to start with one question to everybody. For a second, think in your own community. Think of a few people, one, two, three people, the most resilient people that you can think of. And what do those one, two, three people have in common? You have 1 minute just to think of this, and then I will harvest a few responses from the audience, okay? So just think of it. Let's put maybe some background music on, reflection music, and then we'll hear from you. Do you have it? Okay, who wants to share? Raise your hand. One, two, three people you can think of, happy and resilient. What do they have in common? Sir, over there, what's your name? How?
My name is Fedon.
Fedon. Tell
Uh,
us.
yeah, I think it's my sister, and
Yeah.
I would say also my best friend.
Okay.
And what they have in common is that they are both okay with themselves.
Mm-hmm.
Mainly, I mean, even if they are with someone, or I mean, in like a romantic way,
Yeah.
or even if they don't go out for like days, they are still okay. So I think that's they are okay with themselves.
And how do you think they're doing to be okay with themselves?
What do you mean?
That's my question. How do they, like someone who's not okay with themselves could ask, how do you do it? How do they
Oh,
do?
I don't know. I mean, I think that they have enough in their life, like their hobbies or their everyday things are fulfilling for them.
Mhm.
And then when they go home, if they go home alone, they are okay because they still have things to do, and they're okay with relaxing. But if they go home with their partner, they're still okay because they do those things or other things that they still enjoy. So
Yeah.
I think that's the key.
Beautiful. Thank you so much. So you're very well surrounded. That's good. Your sister and your best friend. Well
Yeah.
done on that. Okay, thank you for sharing. Who else wants to share? Raise your hand. I will continue doing this until someone raises their hand. Yes, sir. What's your name? Or someone will hand you a mic.
Yeah. You are talking here about some poor people living in the outskirts of São Paulo, my
Mm-hmm.
city in Brazil.
Mm-hmm.
No, they are very resilient because they struggle every day with a lot of things. It's very hard to survive. And even though they have this condition, they are so resilient, so happy.
Mm.
So all the time I go there just to be inspired by them.
Yeah, beautiful. And same question. It is a little bit known that Southern people sometimes have this thing of they're just happy. We see that in Africa as well quite a lot. What do you think is this related to?
Yeah, I was curious here in Denmark because you're supposed to be the happiest people in the world, right?
It's true.
So I always reading about that.
True.
Yeah, and
Studies
probably
say
you
that,
are,
yeah.
but again, struggling in life is not easy.
Mm-hmm.
And when you have this poor condition and you don't have enough food on your table, and even though you are happy, so this is amazing.
Mm-hmm. Mm-hmm.
So my
Well,
impression,
we send
as
the thought to
from
them.
the global south of this world,
Thank you. What's your name?
Ricardo.
Ricardo, thank you very much for sharing. Do we have a Danish person in the room to speak up for the Danish happiness? I'm sure we do. One last person, one last share. Thank you. Yes, what's your name? Oh, we're going to hand you a mic. It's okay. That's okay, yes.
My name is Pauline, and I will say my dad because he has his childhood
Yeah.
left, and he's turning 80 next year.
Beautiful. Still a child.
So that's my role model.
Yeah, still a
likes to-
child
yeah.
despite the age.
Yeah.
Thank you for sharing. Beautiful. All right. So, I want to share with you the following chart here with an interesting observation. You see on the split screen on the left, we see the rising mental health challenges on a global level, and on the other side, on the right side of the screen, we see the declining physical activity rates. So it's interesting. What this chart is telling us is that basically we know more about mental health than ever before, yet struggles are increasing. And we have more exercise science than ever, yet people move less. And that's the interesting paradox that is happening and going on at the moment. So, this is the question that we want to talk about today. And the question that we're asking ourselves is also what if the solution, after all, is not so much in the knowledge, because we have the knowledge, but in the connection that we make between those things that we know? And this is what we're going to be discussing over the course of this session and among others in the panel that is going to take place right now. So in order to do that, I would like to welcome on stage our dear panelists. First of all, an ABC approach expert offering a view on a framework that works and advocating for mental health promotion. She's coming from from Curtin University, Australia, Professor Christina Pollard. Thank you for joining us. You can step in however you wish. The second panelist for today is an academic who understands grassroots implementation challenges in resource-limited settings, providing a Latin American perspective on scaling mental health promotion through physical activity with practical research from Brazil's diverse communities. He's coming from the Federal University of Santa Maria from Brazil, Dr. Felipe Xuxa. Hi, doctor. And finally, our third panelist for today, she's a field-based expert and frontline practitioner. She's talking about the EASE methodology and the EASY project from SOS Children's Villages. She's coming from Italy, Sara Salmi. Hi, Sara. Please take a seat and make yourselves comfortable. Okay, so we're going to have a short conversation on the topic quickly. I have a first question for the three of you, so I'd like to know your opinion on for each of you for the same question. The question is the following. If we envision, and you, dear audience, you can also think about this and what would be your answer to that. If we envision mental health promotion as a mountain metaphor, what would be the base camp, the trails, and the summit? Who wants to start?
Me to go?
Yeah, sure.
Okay, so I've thought about this a little bit, and it's lovely to talk to everyone today. In terms of mental health promotion from Act, Belong, Comit's perspective, at the Basecamp, we would be creating a shared vision about where we want to go. We would identify our colleagues and friends who we want to travel with, and we would be looking at setting our goals and identifying leaders to get us through the journey. We would be interested in mental health promotion. So then we would start to consider our trails moving up the mountain. And that would involve looking at the environmental blocks that we're going to find along the way. So, for example, with mental well-being, that might be things like people not having facilities to play sport or not being connected with community. So then we would aim to walk together, because if we walk together, we have a bigger impact. And we would really look at using whatever resources or skills we can find along the way to get us to the top of the mountain. And the summit, once we're there, we will have a society that values mental health, where everybody has the opportunity to be mentally healthy. So that is what we're aiming for.
Thank you very much, Doctor. Dr. Felipe Schusch, what do you think of this? What
Yeah.
would be your metaphor?
Yeah, thank you very much. Well, I think the first step is try to understand at individual level the context, what's the hardest challenge that the person has at the beginning, trying to understand, properly evaluate the mental health before trying to go up. So before climbing up, you have to first set up and prepare and to be properly equipped to go to the trail. So I think that the first thing is to assess properly, trying to understand the barriers, the difficulties of the context where the people is at the moment, and then try to find solutions to overcome these barriers, considering that personal context of that individual. And I mean that by saying that the challenges can be quite different from different contexts, as Professor Ricardo mentioned in the beginning. Trying to understand what means being resilient in a context of poverty is quite completely different. It's completely different than being resilient in another context, obviously with other contexts. So trying to understand that at the individual level, what is the context and what are the challenges and what are the feelings that the person has at an individual level is the first step. Going down to the second step, you have to properly find a way to overcome the barriers, to find a way to find the best trails. That means to conversate with the person, trying to understand what properly is the best way to move, what makes that way easiest and more challenging, what are the specific issues for that person. And obviously to the top is where we find the mental health, is where we find not only less feelings of depression, less feelings of anxiety, but also where we have more mental well-being in general. So for that, the main message is here that every person has its own trail, has its own way, and we have to properly address and understand the context of each individual to find what's the best way to reach to the top. That's my message.
Thank you very much, Doctor. Sarah.
Oh, hi everyone. I might echo you slightly. So to me, the base camp would be preparation. So create the right condition before the climb. So it starts with reducing barriers that we know is massive, both cultural and structural. So it's a huge topic. And then building awareness around mental health so that people start to feel confident in recognizing signs of distress and taking action when needed. So talking about action, this is the time where you would activate not just mental health professional, but also those that we call helpers. So basically anyone that is a coach, a caregiver, a youth worker, anyone who can make support available where people spend their time, where they live, where they learn, where they grow. And at these stages where we would apply evidence-scalable intervention that rely on task shifting. It's just very long to say it. This intervention would rely on non-mental health specialists. And so looking at the trails at this point is action. That's when you start applying these ones. So each trail is different. Some can be, each trail, you choose your trail based on the length and the difficulty of the trail that you want to take. So you could go from very short self-guided or unguided self-help programs to longer multi-session group-based interventions. And we'll talk about those later. But to me then, the summit looks a bit like your summit. You would most probably have a psychologically informed community. And it's the kind of environment where people are equipped to recognize signs of distress, can respond with empathy, and are able to address those who need to the right type of support. So that's a conversation, a sport activity, a community-based activity, or more focused, specialized support.
Beautiful. Yeah, makes sense. Thank you for your answers because they're all different yet targeting the same thing at the end of the day. So really beautiful. Christina, questions for you. According to you, what must be done to effectively advocate for mental health promotion?
I think for mental health promotion, we need to consider the types, we need to actually take a positive health promotion approach which is a population approach. We need to look for the barriers to mental health promotion and focus on how we can create the environment that can make a difference for the general population. We also need to think about equity and equality, because most of the things that in order to make an entire society that is promoting mental health and well-being, we need to bring everyone with us. So in terms of advocacy, it is looking at who we are going to be advocating for and what our key messages will be. And they will be different at different times and at different levels. So it's really a matter of getting together, looking at what the priorities are for advocacy for mental health promotion. And I know that they're different in different countries. And sometimes we look outside our situation, our country, to see what's working and how it's operating in another country. And that's where we get our biggest insights.
And you're coming from Australia, so what inspires you? What other countries do you collaborate with or look at?
I really, as Act Belong Commit in Australia, we've been working with a lot of different countries who have developed and tailored the program to their communities, and there's some amazing innovations that are happening. The thing that's really interesting is that positive mental health promotion can be applied in many, many settings, and the messages are clear no matter who you're working with. So it is inspiring to see innovation happening and people being generous and sharing their resources and materials so that there's a collective impact around mental health.
Mm-hmm. Just like we're doing all together today. Beautiful, thank you. Felipe, what is the impact of movement on mental health? Because you do a lot of studies around this. So I'd like to ask you specifically, if you had to share 3 lessons on the impact of movement on mental health, what would they be?
Oh, that's a great question. Well, we have lots of evidence from many perspectives, from different kind of studies like clinical trials, epidemiological studies. And I think that some short messages that I would put in would be, first, any movement is better than no movement. Some movement is better than any movement. But extreme movement is not necessarily, or extreme physical activity is not necessarily better for mental health than some movement. I'm bringing this information from some studies where we found that even the half of the public health recommendations for physical activity, like even 75 minutes of moderate vigorous physical activity per week, is enough to reduce the risk of incident depression by 18%. But when you achieve higher amounts, and this is going higher until you achieve nearly 300 minutes per week, this is increasing. Like when we have 150 minutes, the risk for incident depression is reduced by 25%. But if you increase much more your physical activity level from that point, the reduction is risk is just going lower, when you can have up to 25%. And doing 400 minutes or 350 minutes per week doesn't necessarily mean having greater benefit in terms of reducing the risk for incident depression. So basically, these are the 3 brief messages that I wanted to share from the literature.
Okay, so we're really saying here, it's echoing a little bit to the chart that we've seen in relation to the physical activity going down, etc., that it's not so much about physical activity or a lot of physical activity, but at least some movement on a regular basis?
Yes.
Okay, so we need to have that element of regularity and consistency?
Yeah, the thing is that for some people, achieving this goal of completing 150 minutes per week can be quite challenging and quite difficult. For people with depression or people with some disabilities, achieving 150 minutes per week can be too much. And from the literature, we can say that even the half can be helpful. So if someone say, okay, if a doctor said, or if we tell someone, okay, you have to do 30 minutes per week every day, and some people just are just not capable of doing that for many different reasons, for physical incapacities, for mental incapacity in terms of level of fatigue, or just because they just struggle to find some time, especially people living in such complicated and difficult situations with low resources. They have to work long hours in their day. When they get home, they're just so tired, they say, oh, I don't have time, I don't have energy because I work at 14 hours today. I don't have energy to do any exercise. But when you say that, okay, you don't need to do 30 minutes per day, every day, you can do just 15. It's like, can be something meaningful, it's the half. Or you don't need to do it three times per week, of which completing 50 minutes. You can do 3 times 25 minutes per each session. That's much more achievable for many people. So that's the point.
Thank you very much, Felipe. Sarah, task shifting. Is this the secret ingredient to mental health promotion?
Thank you for this question. Well, task shift is not much of a secret, actually, because there's lots of research evidence that proves that it is one of the way with which you can bridge the mental health treatment gap. So this systematic redistribution of mental health tasks from specialists in mental health to non-specialists in mental health who have been trained and went through structured training, and they go through supervision and receive continuous support, it's proof that they can implement and deliver intervention that do make a real impact in the well-being of the people that are involved in these activities. However, of course, this is not a panacea, magic trick. It does require very specific condition to work. So it requires structured training, basically everything I mentioned already, structured training, supervision, and continuous support. If these safeguards are in place, then the implementation can be of quality and a safe implementation as well. As part of the EASY project, we are implementing one of these scalable evidence-based intervention that rely on task shifting, that is EASE, so Early Adolescent Skills for Emotion. Basically, through a capability training of 10 to 12 days, helpers, so the people that can make help accessible where people live, involve adults and caregivers through 7 sessions, and then 3 sessions with adolescents. They go through very concrete skills such as psychoeducation, stress management, behavioral activation, and problem solving. So these are very specific skills that can be easily taught and scaled. So the amount of people involved can be way more. So instead of thinking of this as something that means we don't need specialists in mental health, rather it extends the capacity of those that can provide support, and it can be accessed way earlier. That's why this type of intervention are usually used where there is low resources, emergency context, and displacement. Of course, this requires a massive preparation, but among these, one of the key elements is also referral, clear referral pathways, so that these helpers know who to reach out to when support is needed. So this is one of the key steps to make task shifting the secret ingredient eventually.
Okay, we'll remember that. Thank you. One last question, again, for the three of you, on top of what you've shared already. So we have here in the room many different types of stakeholders from many different contexts, situations, background, cultures, countries, etc. What would be for each of you the main or the biggest piece of advice, maybe that you could give them on a key strategy, for instance, something that they could use to adapt mental health promotion frameworks for their local environments? Would you like to start, Christine?
I've been thinking about the focus of this Congress is on movement and physical activity, and mental health promotion also focuses on many other activities that surround movement and physical activity. So everybody in this room could ask yourself, have I done something to improve my mental health and well-being today? And that could be sitting quietly, or helping somebody, or talking to somebody, or connecting. So as a community, if we want to promote mental health through all our organisations, then I would recommend we adopt the principles of Act, Belong, Commit, ABC for mental health, and consider how we can facilitate this social connection. I've heard a lot of it throughout the sessions. You're already doing a lot of this, connecting with people, having people volunteer, but there's much more that you can do. And most people know what to do for their physical health, but they really need to be reminded for their mental health and well-being. So maybe if we start there.
Thank you very much, Christine.
Well, I will give a similar direction and will bring the discussion to my research area. And from the literature, we have some evidence showing that we have both benefit from aerobic and strength training. Basically, the message is doesn't matter what type of exercise you are doing. What matter the most is whether you enjoy and whether you can adhere in the long term of doing that activity. So to properly promote mental health through physical activity, the main message would be trying to find the exercise that can be adhered in a long term, and the exercise or the movement or physical activity, doesn't matter the term you are using, but the one that makes sense for that individual. This is what's going to be sustainable, and for mental health benefits, we need sustainability. We have any activity that can be performed in a long term and sustained by that individual. So we have also some evidence showing that moderate and vigorous physical activity are more effective than light physical activity. But the issue is that many people with mental health issues struggle to do moderate and vigorous activity. So the main message in this regard is trying to start with any activity that makes sense for that person, trying to increase the intensity and the amount of exercise in a long term. But once again, any movement is better than no movement at all. So trying to do what makes sense for that individual, for what brings him or her joy, if it's possible, but at least what makes sense for that individual. That's it.
Thank you very much. And Sarah?
All right, so when I left 2 days ago, I had an idea of how to respond to this question. And after these 2 days at the MOVE Congress, it has been influenced by the many stories and people and everything I heard. So I would look at my notebook, mainly because I can be very messy when talking. So first of all, of course, we need to combine evidence with implementation. So try to understand what works in practice. And to do so, we must keep the voice of people with lived experience involved. So that's the first. I know it had to be one, but
That's
I'll
okay.
put a few that are connected.
We're generous.
Okay, so involve people with lived experience. Then participatory approaches work very well. So always find the time whenever you're planning your actions for meaningful participation. And then this is a thought that it came to me. So sports really provides the opportunity for encounter, respect, and creativity that allows to collaborate across cultures and lived experience, whatever bodily experience. So overall, our future depends in cultivating intercultural and transcultural competences that are inherent into sports and movement. So this is, to me, a very important item. Together with sports, of course, play and arts, so the body that moves can really help humanity face the current and the future crisis. So to me, this is the conclusion of these 2 intense days here with you. So,
Well,
thanks.
thank you so much for combining your experience, your recommendations, and also a wrap up of things that we have already discussed during this Congress. Thank you very much to the three of you for sharing your insights, your studies, your experiences. Let's give them a hand. Thank you too. And Sarah was mentioning something. She talked of body experience, and I promised you some experiential learning. So this is what we're about to do right now. I'm not sure if she's going to ask you to stand up, but just because I'm the referee and I like to do this, I'm going to ask you to stand up. So stand up, everybody. And we're going to welcome for an active break, coming also from Brazil, Nicoli. Nicoli, where are you? She's one of our volunteers. Yes, Nicoli, come and join us on stage here. She's going to activate you for a few minutes with a mental health, mental well-being, and body experience. Nicoli, the stage is yours. The stage is yours.
Thank you. Hello, everyone. Now we are talking about mental health. So we're gonna make an exercise that actually I was doing there now because I'm very nervous. And this is something that we can do when we are nervous or anxious that makes when we are feeling, oh my God, I have to speak, I have to do something very important. And when we are in the place that have a lot of people and we are talking to a lot of people in the same time and do important things. So it's time to breathe in, hold on, and breathe out and calm down. So the first thing that I will ask for you is you are comfortable to be stand up or you want to sit? You're comfortable? Okay. Because we have to feel comfortable. So you can be stand up or you can sit because we are gonna close our eyes. Okay? But first, I want that you put your hand in your chest and feel your beats. Feel now how is your heart? If it's faster, if it's okay. How is your breathing now? If you're just with your mouth off, with your nose. And now you can close your eyes. You are breathe in 4 seconds. I will count for you. You are hold in 4 seconds. I will count for you too. And we are breathe in exhale in 7 seconds. I will count for you too. So take your time and we're gonna start. Breathe in. 1, 2, 3, 4. Hold them. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Breathe in. 1, 2, 3, 4. Hold them. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Breathe in. 1, 2, 3, 4. Hold on. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Breathe in. 1, 2, 3, 4. Hold on. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Breathe in. 1, 2, 3, 4. Hold on. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Breathe in. 1, 2, 3, 4. Hold on. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Breathe in. 1, 2, 3, 4. Hold on. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Breathe in. 1, 2, 3, 4. Hold on. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. The last one. Breathe in. 1, 2, 3, 4. Hold on. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6, 7. Feel your beats. How was your feeling now? This thing that when we put our hands in our chest, we start to release oxytocin because our body feel that we are in care with ourselves. And when we breathe with the counts, we hold and we breathe out with the counts. We make our beats and our crease, our nervous system come down. So we can do this just for a 6 seconds anywhere. Just breathe in, breathe out, and feel your beats. Are you feeling good now? Yes? So thank you so much, guys.
Thank you, Nicoli. So just to close up on this exercise, it's indeed something very easy that you can do anytime, really quickly. I do that exercise myself as well. So it really calms down your nervous system almost instantly. While you're still feeling it, please, now that you're seated, write 3 words to describe how you're feeling right now in relation and after this exercise. Just 15 seconds for that. Write 3 words that describe how you feel thanks to and after this exercise. All right, moving on. So I also promised you some practical action and practical learning. So what we're going to do right now, at your tables, you have probably seen already, there are pieces of paper. Those are case studies. They're real life case studies, real world applications in relation to mental health. What's going to happen right now is that you are going to pick the one that is on your table. You have 3 minutes to read it. So it's the sheet of paper that is in front of you. 3 minutes to read it. And then you will get 15 minutes of group discussion. So there are questions that are prompted on the paper. There will also be facilitators and ABC experts going around the tables to get the conversation going and exchange around this. So we're up for 15 minutes for that. Have fun, share insights, conversations, questions. This is really the moment to get this going. And also later on, share with one another what are the recommendations maybe that you recommend, because as I said, those are real world application case studies. You have so each of you, some of you have different ones, 4 different cases in total. The first one is the Reluctant Teenager Program. The second one is the Workplace Wellness Revolution. Third case is the Community Recovery Initiative. And the fourth one is the School-Based Initiative. So enjoy, have fun, have great conversations around the topic, and I will see you in 15 minutes. Go.
No se lo va a negar. Si la mujer pide, pues yo le voy a dar. Y sepa lo pide.
Very active conversations. Okay, who wants to share? We're gonna take just like 1, 2, maybe 3 shares, just quickly. What were your thoughts? What were your conversations about depending on the case study that you had? Who had case number 1? Who had case number 1? Raise your hand. And who wants to share? You don't have to. On behalf of the respective mental health, I will not force you to share if you don't want to. You would like to share? Okay, someone will come to you with a mic. Yes. So you had case number 1 on the teenager.
Yes. Should I say anything about the case or?
You can just, quickly, and then
Yes,
what were
of
your
course.
thoughts and your conversations about?
We had a case about a teenager who were having anxiety and wanted to drop out of school basketball team, and then we also had kind of a solution that they wanted to introduce her to skateboarding that was aligned with her other interest, and then they made a weekly group session and all this, and then she could build friendships around the new hobby. We talked a little bit about this and also the cost of it, and we thought that maybe it was also interesting to look into the basketball team and say, what is the problem really? Why is she getting anxious? She felt it was a bit competitive and judgmental, but is it only her or is it actually the whole team? And maybe we should look at that she has a community here, and it also supports her mental health to have this community. And when you're 16, it's quite important to keep these like communities around you and the self-development. So we thought it was more interesting looking into the already existing team and see if there was a possibility of changing so everybody was happy in the team. Yeah.
Okay, very good. Thank you so much for sharing. Let's give them a hand. Case number 1. Who had case number 2? Nobody had case number 2 in the room. And who would like to share? Someone? Yes, great.
I can do
Thank
that
you.
from our side. Hi, everyone. So we had the case with the workplace wellness revolution. So basically overwork at work. And the solution was walking meetings and first aid trainings and etc. and etc. Our discussions were that we are quite fortunate because we are here from the north part of Europe. So there were not so much difficulties to implement these things in our organizations, and a lot of organizations already have something like, if you feel that you want to walk, you can just, take a Teams meeting or Zoom meeting or call while you are walking. There is no such a restrictions in our countries, let's say like that. Nevertheless, we also thought about some other possibilities. For example, we all thought about the leadership, so that the culture of organization very much depends on the leadership. So if the leaders are inviting to do the physical activity, it's more becoming a culture of organization as well. So we could do that more. And we also had the male inside of the competition part. So if you do the competition in between organization on, how many steps you take, or if you can do more pull-ups than the CEO or organization, it might be working as well. So that was our observations.
Very nice. Thank you very much for sharing. Case number 3. Who wants to share on case number 3? Yes, go ahead. Someone will hand you a mic.
Hello. We had the case with the Community Recovery Initiative about the town flooding and what happened to support the community and through the sports centers and having people to be educated and have the first aid, like a first aid helpers, let's say. And the discussion was that one specific action we could take is to act proactively instead of waiting for the disaster to come and give the support, to train people in our communities to be first aid helpers about mental support. A potential barrier that we might face, there was a question to answer, is that we might face from the psychologist society and the professional organizations that if these first aid mental health helpers will be enough, and how they should be educated. And one person who could support our initiative, let's say, I'm working in a football academy for youth, so the support could be from the technical director or the committee. And taking this step now to share something more that I'm aware. Recently, I was participating in a seminar, let's say conference, that they showed the peer support system that they are using in aviation. Especially in Germany, in Lufthansa, they did trainings to pilots to be like first aid helpers. And in case a pilot was facing issues, he could call to a number. And one of the trained, they were trained like coaches. So they did some coaching seminars to the pilots. So in case a pilot had an issue, he could call, and in 20 minutes someone replied, a co-pilot, just, I don't know, fellow pilot would answer to him, give him support, and they found very significant results about reducing the stress and the mental disorders, let's say, of pilots. So if this could give an idea about how we can do in our communities and our working environments, I think peer support is a great initiative that could take.
Absolutely. Thank you so much for sharing. Case number 3. Let's give them a hand. And one last chair on case number 4. Who would like to go? Or not? Yes, sir, over there. Great.
Thank you. Hi, I'm Gordon from the Daily Mail Foundation, based in the UK. So our example was the school-based scenario where we had some children who felt excluded from traditional sporting activity, resulting in them obviously suffering poor mental health and not attending school. And the approach was the provision of kind of more mental well-being focused physical activity within the school environment, which unsurprisingly was a big success. And actually, so our discussion was around some of our joint work. Many of us are involved in some provision of sport or physical activity within the school system. And actually, a lot of our conversation was around the opportunity of connecting not only the provision of the physical activity, but connecting and educating children about the things that contribute to our well-being. So it's one thing to actually put on an activity such as the Daily Mile, 15 minutes of activity, but it's then educating our children as to why that activity, getting outside, connecting with our friends, the teacher-peer development and relationships, why those things contribute. Because, you know, through the ABC framework, we've got an opportunity to educate a generation as to the factors that contribute to our well-being. And if we do that in a way which is more inclusive, then all children will feel and be able to benefit and enjoy movement and activity, but also understand why it's making them feel better. And so hopefully in the future, when we're suffering poor health, as some of us do at different times, we can turn to those things with that knowledge and with that empowerment to actually do something about it. So yeah, it was a good conversation.
Thank you so much for sharing on behalf of case number 4. Okay, beautiful. Before we close, we have one more surprise for you. A 5 minutes inspiring keynote from someone who came all the way from Australia. Yes, another Australian. She will have us see one more time how movement is so much more than just exercising. So, dear participants, help me welcome Professor of Health Promotion at Curtin University, Sharon Burns. And the floor is yours.
Thank you. I'll be very quick because I know it's just about time to go. Thank you for all your participation, and it was wonderful hearing the case studies and hearing some of the examples that you came up with because you have all the strategies. So our challenge was that mental health rates or mental health related issues are increasing and physical activities decreasing from a global perspective. Yet we've just heard some really simple strategies that we can do to increase physical activity. And I think our panel really highlighted some of those strategies. Philippe talked about the need to not have to do too much physical activity. It's some physical activity, and to be really cognizant about different types of physical activity that different people can do, and that's something that we need to be thinking about promoting. Some people can go and run a marathon, but for some people it might be going for a bushwalk or, you know, a walk in the park, taking their dog for a walk. Really important factors. Sarah talked about the importance of task shifting, and our research has shown that involving people and involving other people is really important. Some of the research shows that the involvement of volunteers is really, really critical for mental health promotion, and it helps get the message across and in a way that's cost effective, beneficial for the volunteers, but also really beneficial for the people that the volunteers are working with, and lots of different ways that we can use volunteers. And Christina talked a lot about connection, and that came up with a lot of the case studies as well. Connection is one of the really important factors for mental health promotion. We find that people that are connected, whether it's connected to family, community, to neighbourhood, to schools, to workplaces, have much better mental health. And so we need to think about how we connect and how we link in connection and physical activity. And we've talked about that in some of the case studies. Lots of examples of being connected to sports clubs, to different types of activities. So think about connection and inclusion. And we've heard about inclusion a lot throughout the conference. And again, that's another really important protective factor. So as was mentioned, I'm from Australia and we also run the Act, Belong, Commit campaign. So Act, Belong, Commit is really important in everything that we've been talking about. And when we talk about physical activity, Act, Belong, Commit fits in really well. So Act is about doing something. It's about doing something with someone and doing something meaningful. And there's 15 different protective factors that Act, Belong, Commit looks to promote. And I'm not going to go through all those 15 protective factors now. However, we do have lots of research around those protective factors. But not surprisingly, one of the protective factors is physical activity. So physical activity is certainly a big protective factor for mental health. But there's also a lot of other protective factors that link in really strongly to physical activity. So being in nature. So going for a walk in nature, sitting in nature, but doing a little bit of movement. Thinking back to what Philippe says, it doesn't have to be a lot. You might just go and walk and sit in a park for a little while. Connecting with friends. And one of our research studies showed that people who talked with someone outside their home had much better mental well-being than people that didn't. So how do we connect? And we can do that through physical activity. We can go for a walk with a friend, or we can join a sports club, depending on what we want to do. So lots of different things that we can do. Volunteering was really important. And again, that links into physical activity. Lots of good opportunities to volunteer when we participate in physical activity. Doing something challenging. And again, that can be physical activity related and it can vary. So for some people, a challenge might be, running a marathon or, swimming 10 kilometres. For other people, something challenging might be going for a walk or getting out and doing some gardening. So think about different sorts of ways that we can encourage physical activity and promote physical activity. And remembering back to some of the things that the panelists had said, for some people physical activity is not that easy because they may have a disability or because of socioeconomic factors. And there's lots of people that really struggle in terms of coming home. They need to work lots of jobs. They don't have much time. They may have a lot of other factors and a lot of other things going on in their lives. So it's really hard for them to be physically active. And even from a country like Australia, we have a very big divide in people, from people who are quite comfortable to people who are living in poverty, who really struggle. And so think about ways that we can integrate physical activity for those people. So that's all I'm going to say for now, but we are going to finish off with a video which has got some kids in it, which is nice, and they're going to tell us all about physical activity in terms of their kids from a circus or doing some circus activities, and I think that will sum it up really nicely.
For me, circus means inclusivity and exploration. You have to have a level of trust and I guess be open to also making mistakes. Everybody kind of relies on each other. Commitment also equals connection.
Circus is important to the society because it gives an opportunity for young kids like me to express themselves and learn new, unique skills.
I am always a lot happier when I'm doing circus.
I am an artist.
I am a performer.
I'm strong.
I am free.
What a beautiful, beautiful way to conclude. Thank you very much, Professor Burns. In conclusion, every movement matters. I think that's the main sentence to remember for everybody. I would like to ask you now to have one last thought. Imagine we're in 6 months from now, and write on a piece of paper or maybe on your agenda, maybe take your phone out, go on your agenda app and scroll 6 months from now. That will be April 2026. in 6 months, how will you think and relate to mental health and the connection between physical movement and mental health? What will you say? What will be your speech about that? So that's something that you can do now or later. In 6 months, what will be the conversation around this? And finally, I would like to thank you all for your participation. I think this was a beautiful session full of learning, experimenting, exchanging. So this was really, really good. I hope it helped you to increase also your awareness on the topic of mental health and how to take global frameworks and integrate them and implement them on a local basis and in your own environments. You have an ABC card game on the tables. Feel free to use it. Feel free to take it with you. Feel free to make use of it over the course of the next few weeks, months, and maybe even years. And also, one last thing, if you go on the app of the Move Congress, there is a survey. There is a survey. So on the session, when you go on this session, there is a 1-minute survey. The organizers would really appreciate your feedback for them to keep on making this event and those sessions as good as they get to be for you. So if we take one last minute for this, and I will also just take the opportunity to mention on the app while you're at it, there are a lot of resources, additional resources on mental health that have been shared by our partners and experts. So you can also go and have a look at this now or later. So I'll give you 1 minute to fill in the quick survey, and then I will say see you in a very bit. In 15 minutes, we will meet all together in the plenary room for the closing.